What is ADHD and what's going to happen when you go into a psychiatrist's office for an evaluation? In today's video, I will be discussing in general what is ADHD, and then in specific, I will be going into the diagnostic criteria for a diagnosis of ADHD. Before we begin, Assalam Alaikum. Welcome to my channel. My name is Musarat Yusuf Ali. I'm a licensed clinical social worker and a mental health provider. Thank you for joining me here today. I hope you'll stick around till the end of the video, and if you will like and subscribe to my channel so that you will continue to receive more videos like this one. So let's begin at looking at what is ADHD. ADHD is a mental health disorder that impacts the development of the brain. It is a disorder that tends to be diagnosed and seen early on in children. ADHD also stands for Attention Deficit and Hyperactivity Disorder. Sometimes ADHD is also known as ADD, where the hyperactivity is removed. The reason being that not everyone with ADHD, ADD has hyperactivity, and we will get more into that in a little bit. Oftentimes, it is children that are diagnosed with ADHD. However, we know that adults also have ADHD. There was a belief that children would grow out of ADHD, and now we have more information, and the science is telling us that is not true. Most people that have ADHD when they are children will also have it when they are adults. It could be their management of the ADHD, and perhaps if they have been treated when they are children, that will affect their outcome, and they may not struggle as much, and so they don't appear to have ADHD when they're adults. However, if children who have ADHD are not treated with interventions, then they do grow up to really struggle as adults as well. And so a lot of times adults will be going to a psychiatrist or a mental health provider, or just a regular physician, and asking for help and support for their struggles, and then they will realize that actually they always had ADHD even when they look at their childhood history. A really important aspect about ADD is to know that it is a neurological disorder. What that means is that it has an impact on the brain. The development and the growth of the brain and the size of certain parts of the brain, there's 5 particular areas of the brain that are actually affected, impact what will then become ADHD. Now, there are several viewpoints out there about the cause of it, and we will get into that in another video. The first area of symptoms that we will be looking at are labeled as symptoms of inattention. And the thing that's important to note here is that according to the DSM, it says that these symptoms have to be present before the age of 16, and they have to be present for 6 or more months, and they have to be pervasive in multiple areas of their life. So it can't just be, a one-time occurrence. Sometimes people have just one episode of, sometimes a psychotic episode where they do get disorganized, and certain of these criteria will feel relevant, or just a period of your life that something isn't going the way normally things are going. And so we want to make sure that when there is a stress, when these symptoms are happening, that they are happening for a long period of time, and that they are happening across multiple areas. What that means is that this person is struggling in their home environment, this person is struggling in their school environment, or if they're an adult, in their work environment, this person is struggling in their relationships, friendships, intimate partner relationships, family members. So multiple areas are affected, not just one area. So let's look at the symptoms of ADD and exactly what the DSM says. The DSM is a manual that mental health and psychiatrists will look at when they are diagnosing someone. And so this is the criteria. This is the fiqh rule book when it comes to the diagnostic criteria for ADHD and ADD. When we're looking at a child, we are asking these certain questions. And let's go through it together so that you have an understanding as well. Please note though, just because you might identify with some of these criteria doesn't necessarily mean that you do have ADD or your loved one has ADD. We'll talk about that more at the end, and I want you to just get an understanding of what someone like yourself or your loved one or members of your community will be experiencing so that you can have a better understanding and knowledge of what this disorder and diagnosis is about. So I'm going to talk through these symptoms that are there in the DSM. The DSM-5 is the latest diagnostic manual when it comes to mental health disorders. And I'm going to list all of them and go through them together with you, and then know that you have to have 6 or more. So the first one is that this person has a hard time paying attention to small details. And when it comes to a task that has small details, they really struggle with it, or they have a hard time with it, or they have a hard time following these small tasks. So think about things like homework or projects, where we have lots of different steps that have to be taken into consideration. Another symptom is that they are unable to focus and really pay attention to maybe mundane things or boring things, or things like homework again. So children are typically diagnosed, and a lot of times we as clinicians or parents, what they will see is that my child is really struggling with homework. My child is struggling sitting down and doing homework. My child is struggling to do their reading. My child is struggling to pay attention to the work that they need to do. The next one is that they have a hard time following instructions. Or the next one after that is that when you are talking to them, it seems as if they are not paying attention to you. Maybe they are, thinking about something else. Again, there is this lack of, is this person hearing me? Is this child listening to me and hearing me? That feels like it's not there. Another one is oftentimes they are unable to organize their things and information. So a typical example is that if you look at their backpack or if you look at their desk, it is constantly messy, constantly disorganized. So things are constantly dumped in, or just, piles of things are there. The sixth one is that they avoid, or they really have a hard time doing things that need their attention. And this one sounds similar like the second one that I described, where they have a hard time with activities, let's say sitting down and perhaps like playing with Play-Doh, or again, doing their homework. They have a really hard time sitting down where a lot of attention and mental effort is required. Sitting down and let's say doing math problems, a lot of mental effort is required. And so they struggle with this. So the next two are slightly related, and they are that they often lose the things that they need. So often they're losing their homework, often they're losing their glasses, often they're losing, their pencils. They're constantly losing things that they need to get their work done, which also goes into the following one, which is they often forget things that you tell them, just very, very forgetful. And the last one in this inattention category is that they get easily distracted. So let's say they're talking to someone and then something happens. Oop, there goes their attention to the thing that's happening. So they get often easily distracted. So they go around with whatever is grabbing their attention rather than staying focused in, let's say, the thing that they're supposed to be doing, conversation or activity, whatever that is. So these are all under the category of inattention. So the next set of symptoms that I will be describing go under the definition hyperactivity, and impulsivity. Now, as I have said before, not everyone has these symptoms, and so that's why people will often refer to this diagnosis as ADHD or ADD. And let me go ahead and describe them to you so that you can have a better understanding what goes in this category. Remember also that we want to have 6 or more symptoms if they are a child, 16 and under. If they are an adult, then typically we might see 5 or more symptoms from this category. So the first symptom is that they are often fidgeting or moving something like their hands or legs, and they're constantly fidgeting, right? So some part of their body is constantly moving, and it could feel like, maybe even with children, that they have like this motor constantly running. The second one is that they might often get up out of their seat in a situation where they're seated. So let's look at, let's say, school, for example, where a child is supposed to be seated, and they will, move around and get up when it's not their turn to get up. So that's one example. The next one is that they may often run around or move around or get up, and again, this constant motor and feeling of movement when they are in a situation where they are not supposed to be doing that. So again, classic example of children running around, I will sometimes describe it as children bouncing off the walls, constant movement. And with adults and adolescents, the way it's seen is this restlessness again. So it's kind of, tied to that first symptom that I said, restlessness and constantly wanting to move. So oftentimes, this is a hack, and it's also, you will see that in people that have ADHD, that they may constantly have something in their hand. They're doing something with their hands, or they're constantly tapping their legs. So again, that's that restlessness or that desire to keep moving. The next one is that they are often unable to participate in activities that are leisurely and quiet activities. So again, I gave that example of, playing with Play-Doh. Although Play-Doh is a hands-on activity, so they may like that. However, anything that's kind of quiet and dull and slow, leisurely activities, they have a hard time doing this. And then the next symptom is, again, what I said earlier, similar to what I was saying earlier, is that, there's this feeling of they are running on a motor, that motor is constantly running. And it's, they have this go, this rev of constantly moving and wanting to go. The next symptom is that they often talk excessively. So this is the child or the adult who has the runny mouth, talking. There is no period. There is no pause. It's just conversation, like go. And then the next symptom, which is kind of related to this one, is that, when a question is asked, they might blurt out the answer even before the question has been finished to ask. So whoever is asking the question, they might not have completed the question, and the person will blurt out the answer. They are not able to wait their turn, raise their hand, and then answer the question. Now that we've looked at all the symptoms, and you have had an idea of what it is that you could be seeing in your loved one, in your family member, or yourself, there are certain other things that are also part of this diagnostic criteria. The first one is that these symptoms have to be present before the age of 12. As I mentioned, there will be times that, it's not only children, but adults that will be having ADD, ADHD. I am a couples therapist, and so oftentimes I will see ADHD come up in a couple's relationship and tension in the marriage. And so when I am looking at an adult, or when a clinician is working with an adult, they are going to be asking the questions of, what was your childhood like? What are things that you experienced? How did you do in school? What are the labels that you might have received when you were a child? And so every time that I have done an assessment with an adult, I will always see these symptoms are present in their childhood. It's not just something that is showing up in adulthood. It's not just something that's randomly happening. That could be another disorder or another mental health crisis or a situational crisis that the person could be experiencing if it's just happening as a new phenomenon. So it's important to know that these symptoms have been there before age 12. The other thing that's really, really important is that it's happening in more than one setting. It has to be 2 or more settings. So again, going back to what I said earlier, it's happening in the home, it's happening in the school environment, it's happening in the work environment, it's happening with social settings, it's happening with friendships, it's happening with, let's say, intimate in marriage or intimate relationships, it's happening with family members. So, multiple areas where these symptoms are occurring. And it's not just explained by another mental health disorder. So again, it's important to know that if there are other mental health disorders that the person is experiencing, then some of these symptoms could be happening, and there is maybe another mental health disorder that this person could be experiencing. The other thing that is really important is that the person is having an interference, or their quality of life is getting impacted in these areas of their life, meaning that they're not able to cope and it has an impact on them, that it is impacting their relationships, it's impacting, their performance, work, school, whatever that may be, relationships. Again, it's having an impact across multiple areas, and they are being affected by it, or people around them are being affected by it. And I'm going to explain that a little bit in a later video, why I might say that sometimes it's the environment that will let them know that we are struggling with you. And, then they may seek out, okay, what is happening? And again, we'll talk about that in another video, but just to know that it is having an impact in their life, and it is having an impact in more than just one area. And then the final criteria in this category, or in this, these ideas, is that it cannot be explained by another mental health disorder. So people who experience psychosis, for example, they will have some of these symptoms. However, they also have other symptoms that is more related to their psychotic episode or disorder. And so it's important that these symptoms that are described here are not explained by another disorder. And this is why it is really, really important that you use this video or sources online for information. You are the expert of your body, and you are knowledgeable about your body, your mind, your heart, and your soul. And you can find a mental health provider, a professional who has done their work, who has years and years of experience, who has seen many, many examples of people and children with ADHD, so that they can give you a better understanding of, do you have ADD, or do you have ADHD, or no, you do not have ADD and ADHD. So please do not become Dr. Google and Dr. YouTube and just self-diagnose. This video, is supposed to be a helpful tool for better understanding for your loved ones, for our community members who have ADD. It is not supposed to be a self-diagnosis tool. It is supposed to be a source of help and resource in addition to the professional work you have. Once your doctor assesses you, or your mental health provider assesses you, they might tell you that you have combined type ADHD, which is inattention and hyperactivity disorder, or they might say that you have the inattentive type of ADD, which is where I leave out the H, or they might say that you have predominantly the hyperactivity and impulsivity type of ADD ADHD. So some people are prone more to the inattentive type, some are both combined, and then some are more on the hyperactivity and impulsivity type. Now, one last thing that I want to say here is that in my future video, I will also be sharing with you the science of the ADHD brain, and in particular, Dr. Russell Barkley, he kind of has a slight disagreement with the DSM. He feels that the DSM isn't really covering everything that an ADD brain is actually experiencing. And again, we'll discuss that more in my next video, so stay tuned and subscribe to my channel. One thing I just want to say really quickly here is that he disagrees with the inattentive type or parts of the inattentive type. And he feels that it is better understood by another disorder and diagnosis. And that other disorder is something that hasn't been, it's not in the DSM, it's people that are researching it and looking at studies whether this inattentive type is better explained by another condition. So sometimes what happens is that people are experiencing some symptoms, some of those inattentive symptoms, however, nothing is explaining what they are experiencing, and so sometimes they get dumped into this ADD ADHD category. However, we'll talk more about that in another video, so please stick around. I hope that this video has been helpful for you. Again, give me a thumbs up and subscribe to my channel if you have found this helpful. I will be sharing more information about ADD and ADHD and other discussions with mental health disorder topics, and we'll be doing interviews with mental health experts. So stay tuned and come back another day. Take care, and Assalam Alaikum for today.